Hi, I'm Dr. Evan Matthews. I'm here today to talk to you about exercise prescription for cardiorespiratory fitness. This is specifically geared towards the general population in just improving their health. So I do want to highlight a couple textbook chapters that you should probably read along with watching this video. So the ACSM or the American College of Sports Medicine's Resources for the Exercise Physiologist, 2nd edition, chapter 3. And also the ACSM's Guidelines for Exercise Testing and Prescriptions, the 10th edition, chapter 6. You can go to these QR codes here and see which textbooks exactly I'm talking about and find a place where you can buy them. In the sequence for exercise prescription tasks that we've been talking about in all these videos in this series, we are now on 11 and 12, which is prescribing exercise and scheduling periodic tests to redetermine their fitness level and see how the exercise programming is doing. Before we get into recommendations, let's talk for a minute about the dose-response relationship between exercise and fitness and health. All right, so if you look at this relationship line here, so we have exercise frequency or exercise intensity on the x-axis, and we have health or fitness effect on the y-axis. And you can see this black line here. This is the general relationship that these variables have with one another. By increasing the exercise frequency or the exercise intensity, either one, you are increasing the volume of the exercise. So if you're increasing the volume of the exercise and it is a good exercise for whatever the goals of the individual are, then you should see an increase in their health and or fitness, whatever the goal was. Increasing activity for an individual who's sedentary is going to have a greater effect than increasing activity further for somebody who's already active. So if we look at these examples here, so if the sedentary person goes from no exercise to some exercise, and the habitually active person goes from some exercise to a little bit more exercise, they give themselves the same increase in dose. So that, in other words, they both add 30 minutes or something onto their week, onto their exercise programming. This person, though, was already active. This person, that 30 minutes is taken from 0 to 30 minutes, so they weren't active ahead of time. The person who's sedentary is going to have a really big increase in their health and or fitness. The person who was habitually active before you increase the exercise dose is going to get a much smaller response to this. Now, that doesn't mean that they shouldn't increase their exercise dose. Generally speaking, more exercise is good up to a certain point, but just keep in mind that somebody who's never done it is going to see a lot of effect, where somebody who's been exercising, the effect isn't going to be quite as prominent. And that's essentially what this line here is showing you. This S-shape or sphygmoidal line is showing you that the initial exercise dose is always going to have a bigger effect than anything that's going to happen later on when you've been exercising. On that note, we have something called a maximal effect. So here's the maximal effect, and here's where it's demonstrated on the graph here. So at some point in time, this sphygmoidal line is going to decrease in slope and may or may not get to a point where it plateaus completely. The point here is increasing exercise dose, so increasing the frequency or intensity for this person who's already at their maximal effect, isn't going to increase their health or fitness level. All right, so everybody has a ceiling. Once you get close to that ceiling, doesn't matter what you do, you're not going to increase your health or fitness. You're probably just going to increase your injury risk. On a similar note, everybody has a different potential. All right, so there's a variability in the response exercise gives to health and fitness. So if you look at these dots here, these 3 green ones and this 1 red dot, consider these to be all individual people, and they're all exercising at the same exercise volume, so they're all at the same point on this x-axis. But notice on the y-axis, they're in very different places. All right, so we have these people kind of cluster together, and this is kind of the normal. You should expect most people to have a pretty similar effect to exercise, but you're always going to have people who are very high responders. These are the people who you see at the gym and they look amazing, they're really capable, or these are the athletes that have never done it before and walk out in the field on the first day and they're just really, really good at it. Some people are just naturally gifted and they're going to be high responders to exercise. Likewise, there are some people out there who are low responders who would be all the way down here where they're exercising and they get very little out of it. But again, again, the vast majority of people are going to be somewhere in the middle, right along the line, and they're going to have a pretty predictable response to exercise. But just keep that in mind, that there is variability in this, and not everybody's going to get the same response from the same workout. So you can't just look at what a professional athlete is doing or some sort of fitness fanatic and just mimic what they do, because they may be these high responders, and most likely they are the high responders. People who are really good at something naturally tend to stick to it. So somebody who's really into fitness is probably going to be a high responder, or they probably wouldn't have stuck with it to begin with. So just don't expect the same results for every person. I mentioned briefly earlier when somebody's at their max effect or near the max effect, so in other words, they're at this shallow point in the curve, if you just keep increasing the exercise volume, chances are you're eventually going to get them hurt or maybe sick. All right, so that's essentially what's being depicted on this slide. So we added another line here. This red line is your injury risk. All right, so the injury risk is the y-axis for the red line. So as exercise dose increases, you're seeing an improvement in fitness and health, and somewhere near the point where the slope levels off and plateaus, you're going to see this drastic increase in injury risk. For some people, this is going to be a little further down, some people a little further up. Again, there's individual variability here. Everybody has a different ability to tolerate exercise and to ward off injury. All right, some people get injured all the time. Some people can do almost anything and rarely get injured. All right, but most people who exercise consistently for long periods of time are going to suffer some minor injury at some point in time. And again, the more the exercise frequency or intensity or both, the more likely they are to become injured. But the more you exercise, again, up to a healthy level, we're not talking anything excessive here, you're going to see a decrease in the risk of cardiovascular events. So even though you'll hear sometimes people talk about how during exercise the increase of the risk of a heart attack is something they're afraid of. Yes, they do have an increased risk of a heart attack during and immediately after exercise, but it's a really, really tiny, minute increase in risk. And the risk to begin with is typically pretty low. So for most people, having them exercise is going to show a decrease in risk all the time. So in other words, when you're not exercising, your risk level for having a heart attack is going to drop. Yes, it's going to go up a little hair during the exercise bout, just because exercise is inherently risky. And again, a small amount of risk, but your general risk of having some sort of cardiovascular event is going to drop significantly, and it's well worth the risk that you're experiencing while you're exercising. So again, for most people, the long-term reduction in risk greatly outweighs the short-term increase in risk while or immediately after the exercise. Another note I want to mention here is that exercise is essentially a medicine itself, and you'll hear the mantra that ACSM puts out nowadays, which is exercise is medicine, and it really is, and it can interact with other medicines that you think of traditionally, so pill-based medicines, in the sense that if you, let's say you're a diabetic, all right, and you're not used to exercising, so you're sedentary, so you're on this end of the curve. If you were to start exercising, you don't know how it's going to interact with your diabetic medications. And so acutely, this is a bad thing because it makes it very difficult for you to predict how your medication is going to affect you. All right, so you might end up with some low blood sugar moments, or maybe even some high blood sugar moments. Again, sticking with the diabetic example here. But this happens with all types of potentially happens with all types of medications. So maybe you're on a blood pressure medication and the exercise maybe will lower your blood pressure, but you're on this medication that also lowers your blood pressure. So you get a blood pressure that might be lower than what you want, especially immediately after exercise. Hypotension after exercise to some degree is normal. So the point here is you need to be very careful with people who are on medications, especially medications for chronic issues, because adding exercise to the routine may affect how their medication is treating their condition or affecting their activities of daily living. So you might want to be extra careful and start them off slow and slowly progress them as you can see that they are tolerating the exercise. On the good note here, Yes, exercise can affect medication and how it interacts with the body, but chronically, so this, I was talking acutely, so you do one bout of exercise, so I have you exercise for 30 minutes, your medication is too much now because you're not used to exercising and it affects you in some negative way. You have some short-term issue that you just have to adjust your medication maybe and talk to your medical professional to do that, but long-term, chronic exercise is potentially going to decrease the need for that medication, which means you can have the lower dose, have less side effects from the medication, spend less money on medication, and so that can be a good thing. And this is something that also a lot of diabetics will see. Once they start to exercise, they lose a little bit of weight. They don't need as much of their diabetic medication. Some people lose the need for diabetic medication altogether if they lose enough weight. So exercise acutely can be a little difficult to tolerate with certain medications, and a little bit of adjustment needs to be made, but chronically it's usually a good thing. I mentioned chronic and acute exercise a moment ago, and I didn't really define what they meant. So an acute effect of exercise, or acute exercise in general, means something that happens short term. So usually you're talking about a day, a few days, a week, maybe a couple weeks. Once you start getting much beyond 2, maybe 3 weeks, we're talking about chronic exercise. In other words, exercise training. So this is somebody who is now training if they're chronically exercising. And so acute effects to exercise and chronic effects to exercise are oftentimes different from one another, and you need to be aware of both, because again, while some of the chronic effects can be a good thing, some of the acute effects can be not so good. So an acute effect that most people experience is muscle soreness, right? So if you've never exercised before and you do something you're not used to, you're probably going to have muscle soreness for a few days, maybe even up to a week. Hopefully you're not prescribing that much exercise so it's doing that, but some people do experience soreness for the whole first week. That's not such a good thing. It affects their ability to get around. It's uncomfortable. So that's a negative acute effect. However, long term, you're probably not going to be sore. You're probably going to be stronger. You're probably going to be more capable. So again, acute effects and chronic effects of exercise are very different, and you should be aware of both. Let's talk about the components of a single workout session and why we do them. All right, so the 4 major components here are going to be a warm-up, conditioning of some kind, so in other words, your actual exercise bouts, a cool down, and somewhere mixed in is the stretching. All right, so I didn't put a number here because it can be with the warm-up, it can be with the cool down, maybe even intermixed with the conditioning portion. Somewhere you're going to do some sort of stretching. All right, it can also be split up. But anyway, so the warm-up, typically we're talking 5 to 10 minutes of moderate to low intensity exercise, aerobic, full body dynamic type exercise. So in other words, you want lots of movement, you want consistent movement, you don't want to do something, stop, you want a lot of continual movement with that. And so it's going to increase the blood flow to the body, it's going to warm tissues up, which makes them a little more pliable, that's going to decrease the injury risk, and you're also going to gradually increase the heart rate. So during a warm-up, you should gradually take your heart rate from the resting level and gradually bring it up until you get to the exercise level. So whatever your exercising heart rate is going to be during this conditioning session, your heart rate should end at that at the end of the warm-up. And so if you gradually increase that heart rate, what you're going to see is the acute risk of having a cardiovascular event. So in other words, a heart attack, a stroke, something like that, is going to decrease. All right, so if you gradually increase heart rate, what you're doing is you're gradually turning on the sympathetic nervous system. If you just kind of slam that thing on, if you slam on the sympathetic nervous system, what you're going to end up with is maybe cardiac arrhythmias and different issues of the heart that can lead to some sort of cardiovascular event. So again, you want this slow, gradual warm-up of 5 to 10 minutes to bring that heart rate from the resting level all the way up to the exercising level, and you want to do it again gradually. I can't emphasize enough that it needs to be gradual. All right, so after you've warmed up for that period of time, again, you're a little hotter, probably sweating a little bit, your heart rate's higher, you're breathing a little bit. everything's feeling good. Somewhere towards the end of that, you can do some stretching, or you can save the stretching to the cool down. All right, so if you're going to stretch during the warm-up, it's important to note that if you're doing static stretching, so the sort of typical stretching most people think, where you go down, you reach the end of your range of motion, and you just kind of hold it there for 10 to 30 seconds, that's a static stretch. If you do static stretching, you're going to decrease the performance of your muscles to a very small degree. So again, we're talking about health here, but I just want you to be aware that if you're worried about the performance of the exercise, so if you are an athlete, if you're going and running a 5K race and you want to do well, whatever it is, you probably don't want to do static stretching or PNF stretching, so proprioceptive facilitation stretching. You probably don't want to do either of those during the warm-up, because they can slightly decrease your performance, so decrease your power, strength, and speed of your muscles. But dynamic stretching works well in warm-up. Conditioning, we're just talking in general terms here, so 20 to 60 minutes of aerobic exercise mixed with resistance exercise, mixed with neuromotor exercise, and potentially, again, if you're an athlete, some sport activities. All right, so 20 to 60 minutes, so a lot of range here. This is where the vast majority of your brain power should go when you're prescribing exercise to somebody, is what do you do with these 20 to 60 minutes? There's a lot of things you can do, a lot of variations you can do, but this is the period of time where you're actually trying to improve your fitness or health in some way. All right, so this is where we're going to talk mostly about later on, so I'm going to skip past it for now. Number 3 here, the cool down. Cool down is just a reverse warm-up essentially, so 5 to 10 minutes of light and moderate intensity exercise, starting at the heart rate you were during the exercise bout and slowly bringing heart rate back down almost to a resting level. The primary reason why we cool down is to decrease the risk of a cardiovascular event. All right, so again, just like at the beginning, if you ramp your heart rate up really, really fast, you really turn that sympathetic nervous system on, and you're going to potentially irritate your heart and cause a cardiovascular event. If you cool down, if you don't cool down, if you just stop exercise and immediately sit down, depending on the form of exercise, the intensity of it, it's possible that you're going to actually cause your sympathetic activity to ramp up again, even further, and that could irritate your heart, again, causing cardiovascular events. So basically, let's say you're running on a treadmill or something, and all of a sudden you just stop and sit down instead of cooling down. The blood that was in your legs feeding oxygen to your legs is now stuck in your legs, and if it's stuck in your legs, it's not getting back to the heart, it's not getting back to the brain, and that's going to increase the sympathetic drive to essentially get it back into those areas, and so that could end up with some sort of cardiovascular event. Another note about cooldowns are not there to decrease soreness. They're also not there to decrease the risk of having some sort of muscle or tendon or ligament injury. All right. If you're going to be injured, it's going to happen during the conditioning portion. Doing additional strain on the muscles is not going to decrease injury risk. If anything, it might increase it just a hair. All right, so injuries a lot of times, especially things like strains, are just little tiny microscopic tears in the muscle that are going to build on each other and eventually turn into a large tear, and that large tear is your injury. So doing more exercise, which is what a cool down is, isn't going to decrease the tears. The tears are already there. So you can't decrease your injury risk with a cool down. Likewise, you're not going to decrease soreness. So you'll hear a lot of people talking about muscle soreness and lactic acid. Lactic acid does make your muscles burn. It hurts during and immediately after exercise, but usually within about 2 hours, all the lactic acid that was produced by your muscles has been flushed out of your muscles and dealt with by the body. So by the next day, if your muscles are sore, it has nothing to do with lactic acid. It has nothing to do with the fact that you didn't cool down. It has everything to do with those microscopic tears that are normal during exercise, and that just causes muscle soreness. All right, so whether you cool down or not, those microscopic tears are going to be there, and the lactic acid isn't going to be there after 2 hours or so. So the cool down has no effect on muscle soreness, has no effect on injury risk. Its primary purpose is to decrease the risk of a cardiovascular event like a heart attack. Okay, so we talked a little bit about stretching, but let's talk about it in detail now. So with stretching, you want at least 10 minutes of stretching. You want to hit all the major muscle groups, all the major joints, and the goal here is to basically increase the range of motion, or if you're already more than flexible enough, just to maintain your range of motion. All right, so the stretching can happen during the warm-up or the cool-down, which is something I already mentioned, and it doesn't really matter where you put it. Some people will need to put it in the warm-up if they have some sort of issue with a muscle they're trying to work out. They need to lengthen it a little bit before they're able to exercise it safely. But for the average healthy person that's injury-free or completely recovered, at least from their injuries, where the stretching happens, either the warm-up, the cool-down, doesn't really matter. All that matters is that you are stretching. All right, so if you don't stretch, you will lose range of motion over time. So make sure that you're doing a little bit of stretching. Again, 10 minutes is all you need to do, and it's going to maintain or increase your range of motion so that you don't get injured in the future. Now, I just mentioned injuries. Another myth here I wanted to dispel. Stretching does not decrease soreness. It also does not decrease injury risk in people who have enough range of motion. All right. If you don't have enough range of motion for your activity, let's say you have to swing your arm way over your head, you're going to need to have that much range of motion, right? So if you're restricted and you can't swing your arm like that, then of course you're at the end of your range of motion during your activity. The chance of having an injury is higher. So if you increase your range of motion, making it easier for you to swing your arm around, the chances of having an injury is going to be less. All right. So if you did not have enough range of motion for the activities that you're doing, yes, increasing flexibility will decrease injury risk. However, if your range of motion is already sufficient, which it typically is for most people in the sports they're doing, then increasing range of motion isn't going to do anything to decrease injury risk. All right, so if you're able to do the motion without an injury, you're not going to get an injury. So increasing the ability to move isn't beyond what you need isn't going to decrease injury risk at all. All right, now muscle soreness. Again, I already mentioned muscle soreness is just little tiny microscopic tears to the muscle that cause your muscles to feel sore a day, 2 days, 3 days later. All right. Stretching isn't going to get rid of microscopic tears, just like cooling down didn't get rid of microscopic tears. If they're going to happen, which they should, it's a normal part of the training process. It's going to happen during the conditioning section, so in this 20 to 60 minutes here. And wherever you stretch, whether it's the warm-up or cool down, is not going to prevent that. So stretching has no effect on soreness and very little effect on injury risk, and only in people who are not flexible enough for the activities they're trying to do. When doing exercise prescription, it is now recommended that you follow what's called the FITT-VP principle. All right, so that is an acronym. Here is what it stands for. We'll go through these step by step. All right, so the F stands for frequency of the exercise. In other words, how many times per week are you going to exercise? The I is for intensity of exercise. In other words, how hard are you going to work? The first T is for time or duration of exercise. So is it going to be 20 minutes long? Is it going to be 30 minutes long? Is it going to be 60 minutes long? The second T stands for type of exercise. We're talking now about mode of exercise. So are you running? Are you biking? Are you swimming? What kind of exercise are you doing? You're doing resistance training. What form of exercise? Then the VP. So the V stands for volume per week. So volume per week is essentially the frequency times the intensity times the time. So it's the FITT part of the principle multiplied by each other. So it just kind of puts it all in one number so you can get an idea of total volume of your training. All right. And then the P stands for progression of exercise. So how will you increase your volume over time? Are you going to increase intensity? Are you going to increase frequency? So you're going to go from 2 days per week to 3 days per week. That's a progression. All right. So that's what the P stands for. Another acronym I want to introduce quickly here is the SMART Goal acronym. And you're going to see a lot of variations on this depending on the different textbooks you look at. But basically, this is a way of prescribing goals so that they are action-oriented and that they are achievable and possible and something that's going to motivate the person rather than demotivate them. The SMART acronym stands for specific, measurable, action-oriented, realistic, timed, and self-determined. And we'll talk more about that in another lecture. Right, so the FITT-VP principle is what you're going to use in order to prescribe exercise, and you're going to use the SMARTS acronym to shape how that prescription is made. All right, but let's talk about the FITT-VP principle, and let's apply it specifically to cardiorespiratory exercise, which is the purpose of this lecture. Keep in mind that the FITT-VP principle should be used for resistance exercise. It should be used for all types of exercise. All right, so we're going to go letter by letter in the FITT-VP principle. I like to start with volume, so the V part of that. First, I know it's a little out of order. We'll get back into the order with the next slide, but the volume kind of sums everything up, so it's a nice place to start. All right, so the recommendations I'm going to be giving here are the minimum recommendations for health. All right, so this is what you need to do in order to improve your health, to decrease your cardiovascular risk, and to hopefully increase longevity, so living longer. If people are not doing at least this much, then they are not meeting the exercise recommendations, and so they are not an active individual when trying to determine if they need health clearance or physician's clearance or any of that kind of stuff. We're going to be mentioning both moderate and vigorous intensity exercise throughout this part of the lecture, and it's important to note that people really should be meeting the minimum recommendations for health with moderate intensity exercise before progressing them to vigorous intensity exercise. Vigorous intensity exercise is a step beyond, so if you can't do moderate, you can't do vigorous, at least not healthfully. Some people will jump straight to vigorous, they'll do it for a week, maybe 2 weeks, they'll be super sore, they might end up with an injury, and then they end up quitting. So you need to start with moderate intensity exercise and gradually build up to vigorous. We have 3 different prescription options for volume. The first one here, which is minutes of moderate intensity exercise or minutes of vigorous intensity exercise per week. So it's 150 to 300 minutes of moderate exercise or 75 to 150 minutes of vigorous. Notice that the numbers are twice as much for moderate as they are for vigorous. So essentially, 1 minute of vigorous intensity exercise is worth 2 minutes of moderate intensity exercise. So if you start doing a combination of these, which you're going to want to do when you progress people from moderate to vigorous intensity exercise, you need to do that math in order to figure out if they're meeting the minimum requirements. So for instance, let's say somebody's doing 100 minutes of vigorous intensity exercise plus 100 minutes of moderate intensity exercise. This is actually equal to 300 minutes of moderate intensity physical activity for the week as far as the health benefits you're going to get out of that. So again, you have to do the math. Every minute of vigorous is worth 2 minutes of moderate, and so every minute of moderate is obviously worth one minute of moderate. All right, so that's the prescription option 1 for volume. Prescription option 2 for volume is 500 to 1,000 MET minutes per week. All right, so remember, a MET is the metabolic equivalent of rest. So a MET minute is if you multiply the MET value of the exercise by how many minutes you're doing it, that's a MET minute. All right, so for example, if somebody's doing 20 minutes of exercise 5 times more difficult than rest, in other words, 5 METs, you multiply 20 minutes times 5 METs, and you end up with 100 MET minutes. All right, so MET minutes are pretty simple. It's a nice way of bringing moderate and vigorous intensity exercise and bring all intensities together into a single number that is fairly easy to conceptualize. All right, the third option here for volume is to prescribe exercise by kilocalories expended during exercise during the week. And if you do that, the goal is 1,000 kcals. And so remember, you can calculate kilocalories from absolute oxygen consumption by just multiplying liters per minute of oxygen consumption by 5. That'll give you kcals of energy expended. It's important to always remember that the goals of the client are what are most important to you and what you should help them achieve. Now, of course, you can help shape those goals. When we talk about SMARTS goals in another video, we'll be able to understand sort of how you fit all this together a little bit better. But it is the proper dose of activity is always going to be dependent on the goals of the clients. And so what I mentioned on the previous slide and what I'm going to mention on the future slides in this particular lecture are just minimum requirements for health that you need to get them to. Going above and beyond that and how you go about this. So the modes of exercise, the intensities, they're all going to be dependent on the goals of the client. Make sure that you listen to your client and give them what they want rather than just prescribing exercise as like a one-size-fits-all. You don't want to do that. You want to cater to your clients. The frequency of exercise. So the F in the FITT-VP principle You want to do 3 to 5 days per week of aerobic exercise. So this is dynamic whole body type exercise. You're going to raise your heart rate. You're going to sweat a lot. That's the kind of exercise I'm talking about. Running, swimming, cycling, walking. Those are aerobic forms of exercise. If you are doing moderate intensity exercise, you need to do at least 5 days. So remember, I said 3 to 5 days. That's dependent on the intensity. So 5 days per week is what you would need if you're doing moderate intensity exercise. You need at least 3 days per week if you're doing vigorous intensity exercise. And if you're combining moderate and vigorous exercise, you need to sort of do the math and figure out where you need to be between 3 and 5 days per week. All right, so if you're doing a little bit of moderate intensity and a lot of vigorous, you can probably do 3, maybe 4 days per week. If you're doing mostly moderate intensity exercise, you probably need to go all the way up to the 5 days per week. While athletes oftentimes will do greater than 5 days per week, for the general healthy population whose major goals are just to be healthier, you really probably don't want to do more than 5 days per week. People burn out and it greatly increases the risk of injury. So more than 5 days a week isn't a good idea. And also doing fewer than 3 days per week while also meeting the volume recommendations is also going to increase injury risk, and it's not something that's recommended. So in other words, if instead of spacing out your exercise for the week across 3 days, you decide to cram it all into 1 day or cram it into 2 days, you're doing a lot on those 1 or 2 days, and the chances of getting injured are going to be much higher. So it's not something that you want to do to your athletes or to your clients. I am now looking at the ACSM guidelines textbook. If you want to, again, figure out which book I'm talking about, scan this QR code. It'll take you to a link where you can find out about the book and purchase it if you don't have it already. But please, if you don't have it, go get it and then come back to this video. But go ahead and get your textbook out. Go to table 6.1. That's what I'm currently looking at and what I'm going to be discussing here. So looking at table 6.1 is going to give you an idea of what different intensities, so categorical intensities of exercise, so very light, moderate, vigorous, or maximal or near maximal exercise, and what that means as far as different intensity methods. So in other words, different ways of prescribing intensity. So heart rate reserve, VO2 reserve, heart rate max, VO2 max, so a percentage of those, or ratings of perceived exertion, RPE. I personally am partial to heart rate reserve just because I think it's fairly easy to get those values and calculate those values on an individual, and there's a lot of benefits to heart rate reserve over just a percentage of heart rate max as far as the accuracy of the calculations, so especially if you start getting to very old individuals where their max heart rates come down quite a bit. It takes that into account a little bit better than just a straight percentage of max heart rate. All right, so moderate intensity and vigorous intensity exercise is what is generally prescribed in order to improve health. So moderate intensity, we're talking 40 to 59% of heart rate or VO2 reserve. And vigorous intensity exercise, we're talking 60 to 89% of, again, heart rate reserve or VO2 reserve. All right, so if you're talking about the RPE scale, we're talking 12 to 13 for moderate and 14 to 17 for vigorous. The heart rate max and VO2 max, straight percentages of those are going to be very different. So I'll let you look at the textbook and see those on yourself. There's a reason why I recommend heart rate reserve. The numbers are really simple and easy to learn, and they also are interchangeable between heart rate reserve and VO2 reserve. So I just think they're easier to use, they're more user friendly. So I prefer those myself. But any of these are going to be perfectly fine and accurate ways of prescribing exercise intensity. Let's talk a little bit more about what it means to be a reserve measurement. So I said heart rate reserve, I said VO2 reserve. Those are reserve measurements. You can also do MET reserve. There's multiple reserve type measurements out there. So basically what we're talking about, a reserve is what you have the capability of doing above rest, right? So for instance, if you're talking about heart rate reserve, maybe your resting heart rate is, say, 70 beats per minute. All right, so if your heart rate is 70 beats per minute, but you have the capacity to go up to 200 beats per minute at maximal exercise, that means you have a reserve of around 130 beats. So you have 130 beats that you're not using that you could use. All All right, so that's what the reserve is. Again, it's the area between your resting level and your maximal level for whatever variable we're talking about, heart rate, VO2, METs, whatever. When calculating a percentage of a reserve unit, so heart rate reserve, VO2 reserve, all you do is you take the maximal level, you subtract out the resting level, and that gives you the reserve. Then you multiply that reserve by a percentage, whatever you want to work at. So if you want to be at 40% of heart rate reserve, which is the minimum for moderate intensity exercise, you would just take a max minus rest, multiply by 0.40, so it's a decimal form, not a straight percentage. So 0.40 is 40%. And then you add back in the resting level in order to get it back up to what it would actually be during the activity. So to give a couple examples here, let's say your heart rate is 70 beats per minute at rest, and you have a max heart rate of around 180 beats per minute, which is about what you would expect for, say, like a 40-year-old person. All right, so if you're trying to calculate 40% of heart rate reserve, which again is the minimum for moderate intensity exercise, it would be 180 minus 70 times 0.4 for the 40% plus 70, so adding back in what you subtracted out, and you end up with 114 beats per minute. And you can do the same thing for VO2 reserve. So if it's everybody has a VO2 at rest of around 3.5, so generally speaking, you can just assume 3.5. You don't have to actually measure or do some kind of calculation to get the resting VO2, which is a nice thing for this calculation. But you do need to figure out their maximal level. So let's say their max is 43, the rest is 3.5. So you would do 43 minus 3.5, so max minus rest, multiplied by the percentage, so 0.4 for 40% of VO2 reserve. And then you would add back in the rest, 3.5, and you'd end up with 19.3 milliliters of oxygen per kilogram of body mass per minute. That would be 40% of heart rate reserve or 40% of VO2 reserve, because again, these are interchangeable with each other. So 19.3 mLs per kg per minute is the same exercise intensity as 114 beats per minute. So some of this is estimate based, some of this is making some assumptions. So if you were to actually measure, get somebody to 19.3 and it's this individual and try to measure their heart rate, it's not going to be exactly 114, but it should be very close. Again, these are interchangeable with each other with some degree of error in that. Another way of measuring intensity, this is really good for beginner clients. So if somebody's sedentary, novice to exercise, never done it before, and you're working with them for the first time, and you just kind of want to get a light exercise in, you're trying to gauge them on exercise, or you're trying to teach them something they can do on their own if they're not going to work with you long term, you can teach them the talk test. So with the talk test, you have them exercise, and while they're exercising, while they're at a nice steady state, you try to have them talk to you. If they can easily talk, it's a light or low intensity exercise. If they're able to talk but they couldn't sing if they wanted to, in other words, they have to take the occasional deep breath, that is a moderate intensity exercise. If it's difficult to talk, meaning they're taking breaths every few words, that's a vigorous intensity exercise. So the talk test isn't perfect, but these categories are pretty good. You're not getting a precise number on things, but you're going to know with some degree of certainty how difficult the exercise bout is for them and what intensity it is for them. Another form of intensity prescription is the ratings of perceived exertion, or RPE. And so you can see there are two different RPE scales here. There is the old Borg 6 to 20 scale, and there is the CR10, or the category ratio 10, 0 to 10 scale. All right, so let's talk about the Borg scale, because it's probably the most common. I will say this, the 0 to 10 scale is becoming more and more common, but the 6 to 20 scale has been around so long that a lot of people use it. All right, so the reason why it is 6 to 20 is it was supposed to roughly approximate heart rate. So if you were to take somebody who's around 20 years old, which is the type of person who's going to have a max heart rate of around 200 beats, and you have them exercise, and you had them give you a number between 6 and 20 using these words to describe the intensity of the exercise and how hard they are exerting themselves, all you could do is add a 0 to the end and you would get approximately what their heart rate is. So if somebody said they are an 11, you add a 0 to that, that means they're around 110 beats per minute for their heart rate. Now, it's not really all that great for doing that. I don't really recommend using it in that way, but just so you know where the 60-20 came from, because it's kind of this arbitrary cut points, that's where it came from. You want to make sure that the person is progressing. All right, so at rest, tell them they're a 6, maybe a 7. As soon as they start doing anything, whether it's the lightest, easiest exercise possible, they're no longer a 6 or 7. If somebody is continuing to tell you they're 6, 7, or even 8 when they're exercising, they're on a treadmill, they're running, they're saying, oh, this is an 8. No, it's not. They're not using the scale properly. All right, they have to progress through the scale. You need to train them to do that. People are terrible at using this if they haven't been trained to use it. I see people all the time, even people who should know better, using this scale, and it's completely irrelevant when you allow people to tell you 6, 7 the whole time. I've seen people do VO2 max tests where they are going all the way till they can't run anymore. They'll say 6, 7, maybe 9 the entire time, and then they stop exercising. You say, well, how hard was that? And they'll say it was a 20. Well, where was the time in between? And that's how most people are. People are really terrible at this until they're trained. Once you're trained to use it, people are pretty good at it, and it's actually very useful, but you need to train them. Looking over here, you can see exercise intensity and essentially where it lines up with the different RPE scales. So moderate intensity exercise is a 12 to 13 on the 6 to 20 scale, or a 5 or 6 on the CR10 scale. Vigorous intensity exercise is 14 to 17 on the 6 to 20 scale, or 7 or 8 on the 0 to 10 scale. And so you can see the rest of the words here to help guide the exercise prescription, as well as how difficult it feels for the individual. So make sure that when you are using this, that your client is telling you full body exertion. All right, so let's say you have them on an exercise bike, their legs are burning really bad, and they tell you, oh, I'm like a 19 right now. And you ask them, well, how do you feel? What feels like you're working hard? What makes you think that? And they say, oh, my legs are really burning. The RPE scale isn't meant to be a single part of your body. It's meant to be an all-encompassing scale of exertion. So if they're saying their legs are what's burning, that's not them. They're not really using it properly. So if the legs are burning, but their upper body feels absolutely fine because it's not being used, their lungs, they're barely breathing, the heart rate's not that high, so their heart's not working hard, the only part of their body that's working hard is their legs, then they're not probably a 19. All right, so you need to teach them that as well, that try to put everything together, their entire body together, kind of average it out and come up with a number that feels like their total body's exertion level. If you've never used RPE before, I do have a video here explaining how to use it, so you can scan this QR code and it'll take you to that video so you can learn a little bit more detail on how this works. On to the first T in the FITT principle, or the FITT-VP principle, so time. All right, so generally speaking, the more you extend the time, so in other words, the greater the duration of the exercise bout, the greater the gains in health and fitness are going to be. All right, so more exercise, some more duration, more intensity, more frequency during some more times per week, all those are going to increase a person's outcomes, their exercise outcomes, so their health and their fitness level. Again, up to the point where they start hitting their physiological ceiling or get injured. But the optimal duration for this is going to also depend on intensity. So if the person is doing moderate intensity exercise only, you're looking at 30 to 60 minutes per session. If they're doing vigorous intensity exercise, it can come down to 20 minutes per session, or it can go all the way up to 60, just like the moderate did. So basically this means, like I mentioned before, every minute of vigorous intensity exercise is worth almost 2 minutes of moderate intensity exercise. And so you can always do a little less time if you're working at a higher intensity. Another note about the time here is it's something that can be accumulated throughout the day. So you can do multiple bouts of exercise throughout the day, add them all together, and that can get you up to your 30, 50, 60 minutes, whatever it is that is your goal for the day. If you're going to do that, you need to do at least 10 minutes per session. If you're not doing at least 10 minutes per session, you're not going to have your heart rate raised, and so you're not going to get the full effects of the exercise bout, and so it's not going to count towards your total time for the day. So again, let's say you want to do 30 minutes for the day, which is kind of the bare minimum here, and you're doing moderate intensity exercise. that means you need to walk at least 3 times that day for 10 minutes each. So maybe you walk 10 minutes to work, you walk 10 minutes on your lunch break, and you walk 10 minutes home from work afterwards. That will give you your 30 minutes for the day. So it's a really good way of breaking it up for people who are either low fit and can't do it all at once, or people who see themselves as being too busy to just set aside 30 minutes of their day all at one time. As mentioned before, make sure that your client is always meeting the moderate intensity exercise recommendations before they try to progress to vigorous. If you're progressing them straight to vigorous and they haven't exercised before, they're probably going to get hurt. They're probably going to hate exercise because they're going to get too sore. It's going to be too difficult for them. Start at moderate and then progress into vigorous. Some people need to actually start below moderate and start at a low level, especially older people who are maybe elderly, haven't exercised in 30 years. They might even have to start below moderate. So make sure you're not starting them immediately with vigorous intensity exercise. The second T in the FITT-VP principle stands for type. By type, I mean the mode of exercise. All right, so the mode of exercise, it should always be something rhythmic with an aerobic component using large muscle masses and just constant, continuous dynamic movement is what we're talking about. So when you think of aerobic exercise, you think of these things that are big movements that are constantly happening. So that's where the rhythmic, so you step, you step, you step, that's the rhythm, right? And so running, cycling, swimming, walking, rowing, those are the types of exercise that we're talking about here. So those are the modes or the types that you should be prescribing to your clients because they're going to be the ones that improve cardiovascular health the best. You also, though, need to think for a moment about specificity. If somebody is simply exercising because they want to be healthier, specificity might not be that important. You just need to prescribe them something. But if somebody is training for something specific, so again, we're not really talking about athletes or anything here, but a lot of times people come into a fitness center, a 45-year-old who says, I want to run a 5K road race in 6 months. I've never done it before. They have a goal. Even though they're not an athlete, it's still sort of an athletic goal. So specificity matters. And specificity basically means you need to train the person the way they want to compete or the way they want to do something, right? So if they want to run a 5K road race, specificity principle tells you need to have them running. Let's say they want to go climb a mountain. Specificity principle means you need to have them doing some sort of climbing-like exercise. Specificity just means do whatever you're going to do in your athletic pursuit or your goal during your training, so that the work you do during training carries over as best as possible to whatever the outcome is that you're hoping to get. On the flip side of that, if somebody has no real goals for a specific type of exercise, so specificity, if it just doesn't make sense, it's not important for the person, then I don't think you should stick with one type of exercise the whole time or even the majority of the time. Instead, what you should do is use a variety of exercise modes. So if you're doing running one day, swimming another day, cycling another day, as long as they're given enough time to sort of get used to each one. So maybe you want to do one and only one for a week or two, let them get used to that, and then incorporate another one a day or two a week, let them get used to that before incorporating a third. So build them up to it slowly, but in the end, you want them doing a little bit of a lot of different things. Right? It's going to help by decreasing exercise boredom because you're not doing the same thing every time you exercise. So they're more likely to stick with it. And it's also going to decrease the risk of overuse injuries. So if somebody's running all the time, running is going to give people injuries eventually. It's a very injury-prone sport because there's a constant pounding in the same way every single time they step out there. So if you're doing running one day, swimming another day, the stress on the body is very different. So they're going to get fit in a slightly different way. They're also going to strain their body in a slightly different way, again, decreasing the risk of having overuse injuries. So continuing to talk about the type of exercise, I'm looking at the ACSM guidelines textbook on table 6.4. Again, you can scan this QR code in order to get yourself to a website that's going to show you where you can buy this textbook if you don't already have it. But again, table 6.4 has modes of aerobic exercise and categorizes them by exercise group. All right, so group A is an exercise that can be done basically by any healthy individual. It's low skill, it's low intensity. All right, so things like walking, leisure cycling, stuff that most people can do without having any previous training, whether it's exercise training or skill-based training. When you get to exercise group B and beyond, now you're getting to exercise types that are going to require some sort of previous training, again, whether it's fitness training or skill-based training for that activity. So group B is going to be also one that requires minimal skill, but that is going to require a certain base level of exercise fitness. So something like running. All right, so most sedentary people are not going to be able to go out day one and run. They need to build up to it. They need to walk for a little while and then slowly build themselves up to running. Category C exercises are going to be ones that require some level of skill to them. So they're probably going to have a little bit of an increase in intensity over the group A classification, but not always. But these are things like swimming, cross-country skiing, maybe inline skating, things that do require some coordination, a little bit of knowledge in how to move, how to do things in that particular environment. All right, so you're not going to take somebody who's an elderly individual who's never exercised a day in their life and have them doing cross-country skiing on day one. They're just not going to be able to do it. You need to build them up with some sort of group A exercise where it's light intensity, low skill. All right, so group D exercises are going to be the ones that have the highest intensity and the highest skill combined. So those are the ones that are the hardest to build somebody into. So these are typically things that are like recreational sports. All right, so you're not going to have somebody going out and playing soccer who is 90 years old, has never exercised a day in their life. All right, they're not going to have the skill to do it. They're not going to have the fitness level to do it. And so this is something that needs to be built up very, very slowly and progressively. Get them closer to that rather than just jumping them into that. So the type of exercise or that you choose needs to fit the type of person that your client is. Again, if they are low fit, low skill, they need to be doing group A exercises. If they are one of the other categories, then you can jump to that, but you need to make sure that you categorize them correctly and that you use exercises that fit them properly. The P in the FITT-VP principle stands for progression. So in other words, how you're going to increase their exercise dose so that they get greater effects from it. All right, so first off, you should probably increase duration before you increase intensity for somebody who's brand new to it. All right, so increasing intensity is very difficult. Increasing duration is a little less difficult. And also you need to get them to a certain level before you start progressing them to vigorous. So if they're not meeting the minimum requirements for moderate intensity exercise, you shouldn't be progressing them to the vigorous intensity exercise yet. An example for increasing duration that is probably safe and effective would be maybe to increase 5 to 10 minutes per session every 1 to 2 weeks. All right, so a very small increase in duration and do it sort of slowly over a period of time. All right, so remember, some people are going to have to start at low or light intensity exercise, and they're not going to be able to go straight to moderate intensity exercise. Even though it sounds easy for you, remember that you as an exercise professional are not the norm. You're never going to be the norm. Hopefully you're never going to be, because that means you stopped exercising. But the normal person is sedentary, very low fit, and not capable of doing the things that you think are easy. All right, so to them, the things you think are easy are very, very difficult. So please, please, please know your clients, know your population, and don't try to prescribe exercise to them the way you would to yourself or to one of your friends or something. All right, so again, start them off at a very low intensity, especially for a severely deconditioned person, and progress them up to moderate intensity. And then from moderate intensity, once they've met all requirements, progress them up to eventually incorporating some vigorous intensity exercise. So I want to mention here that moderate intensity exercise is enough to get most health benefits if you want to improve fitness. So the difference between fitness and health is just preventing yourself from dying prematurely or having some sort of disease prematurely. Fitness means you can do things easier or you can work at a higher intensity safely. All right, so to increase fitness, not just health, you really do need to incorporate a vigorous intensity exercise. But again, you have to get there. You have to get past moderate first. You can't get them straight to vigorous right off the bat, or you're going to hurt them or they're going to lose motivation and quit. So never increase duration and intensity in the same week. It's not listed here, but it really should also say never increase frequency with these either. So pick one per week. So in duration, intensity, or frequency of exercise, pick one per week and increase that and nothing else. All right, never increase more than one of those FITT items, so frequency, intensity, or time. Never increase more than one of those per week. If you do, you're increasing the risk of injury by a lot. So make sure that you don't do that. Regularly retest your clients' fitness levels. So initially, you're probably going to want to retest them in 4 to 6 weeks because people go from sedentary to semi-fit pretty quickly, and you need to retest them quickly as well. After that, so after the first round of retesting, you can probably do every 2 to 6 months and have a pretty good idea of where they are, because the progression slows down a little bit after that initial period of time. But again, start them off slow, progress them slowly, and retest them often at the beginning, and then retest every so often, so every several months, so 4 or 6 months, something like that, after that. For aerobic fitness, or for just health that is related to aerobic exercise, it's important to note this is not the same as resistance training. With the resistance training, you can reach a level of fitness and then you can kind of back it off a little bit and maintain it. For aerobic health and aerobic fitness, you need to get up to the intensity and basically the FITT, so the frequency, intensity, and time that you need to reach that level of fitness, but then you have to maintain it at that level. As soon as you drop it down, you start to lose your fitness. So you detrain pretty quickly with aerobic training, so you can't drop down your level of training and expect to stay at that level of fitness. It just doesn't work that way with aerobic training. If you want to look at a nice table that puts all these recommendations together related to the FITT-VP principle, look at table 6.5 in the ACSM guidelines textbook. So again, you can scan this QR code here and it will take you to a site where you can buy that textbook. Again, table 6.5 has a lot of these recommendations all in one nice, easy package together that's easy to read. So as the fitness professional, you need to determine whether you need a supervised or an unsupervised fitness program for your client or for the population that you serve. All right, so supervised programs are really good for high-risk individuals, so people who, maybe cardiac patients. So cardiac rehab facilities are usually going to be supervised programs. They're also very good for novice individuals who don't have a lot of exercise knowledge or experience, who don't know what they're doing, don't know how to use the exercise equipment, and so it's good to have some close supervision with them in order to get them to the point where they can, just work the machines on their own, essentially. And also, supervised programs are very good for low motivated individuals. So people who are likely to quit if they're all by themselves. If you're there, it gives them a little accountability. It gives them somebody who's a sort of a cheerleader and motivator to them, and so they're more likely to stick with it. Unsupervised programs are okay for people who are fit, who are probably going to stick with it anyways because they have a lot of motivation. People who are low to moderate risk of cardiovascular disease, so people that have some risk factors but don't have any signs, symptoms, or previously diagnosed disease. It's good for people who, if somebody's already been diagnosed with cardiovascular disease, which automatically puts them at high risk, you can use unsupervised programs, but they need to complete a supervised program first, and they should have been medically cleared before ever starting any kind of exercise program. All right, so they can eventually get to an unsupervised program, but they need to be watched for a little period of time first. If working with these high-risk people, make sure that you emphasize low intensity. So start very, very low and very slowly progress them. Do not do too much too quick, so don't push them too hard. Because it's not just going to be a muscle strain or something like that. They might have something like a heart attack, which is way worse for both them and for you. So make sure that you start them low and progress them very, very slowly rather than jumping them up. anytime you're working with people who are exercising, you need to think about the environment they're exercising in, because it's going to affect their ability to perform the exercise, and it's also going to affect the safety of the exercise that you're prescribing to them. So make sure if the weather's hot, if it's humid, if it's cold, if it's rainy, if it's icy, if there's snow on the ground, if there's poor lighting, so if they're exercising at night outside, if there's tripping hazards, so maybe the sidewalks aren't even. That's something that I experienced in my area. I've tripped multiple times. Anything like this is something that you need to keep in mind, because you need to prescribe exercise that's going to work for your clients and keep them healthy. And if you're not considering the elements, you might get yourself into a situation where especially if you're working with them in a supervised program, where you're going to be found negligent because you should have taken them inside. You should have prescribed something different because maybe it was unsafe, especially, a hot, humid day, and you're having them out there running, sprints all day long, running up and down bleacher steps or something like that. It's not appropriate, especially for somebody who's low fit, who might have some extra weight on them. So you need to make sure that you're adjusting your exercise prescription for the environment they're going to actually exercise in. All right, so that was an overview of exercise prescription for cardiorespiratory fitness. Of course, there's more information that we could go into, but this is sort of the basics that will get you started. And this was geared towards healthy individuals who are basically, just trying to improve their health, maybe a little bit of fitness improvement, but we're not talking about athletes. We're not talking about clinical populations in this chapter here. So hopefully that was helpful to you. Please put any comments or questions below in the comments section, and I'll try to get back to you on those. Otherwise, please come back and watch another video. Thanks.